The self-management courses are aimed to give people tips and tools that they can use so they can actually self-manage their own conditions. I have MS myself, so I know what it's like to live with a long-term condition, and the self-management learning is really important in the journey. You're moving on to the goal setting, so we've covered that twice today already, so it's the same kind of format.
I think what self-management means to me is when the patient takes ownership of their own health, learns lots about their condition and how to live with that on a daily basis, and to enable them to live a nice, happy, full life opposed to something that's affected by the condition that they've got. I think for patients it means that they can help themselves through difficult periods by learning coping mechanisms, also by learning about local organisations and self-help support groups and peer support groups and things like that.
I'd probably say self-management is about people taking ownership of their own health and having the skills and knowledge to maybe look at how they can stay well for as long as they can, or deal with any relapses that come along as well.
For people to self-manage effectively, I think the key thing that we see is that they get to know themselves, given that they have a long-term condition. So when they're stable and things are going well, it's going to be different from how it was before for them. But if they can get to know how their symptoms are, so for instance in COPD it might be breathlessness, it might be their level of tiredness or an ability to do their everyday normal things. And if they get to know themselves well in that sense, they can hopefully quickly realise when things are starting to go a bit awry.
It's really about building their self-confidence. It's about enabling them to ask questions, to feel that they're empowered to ask questions, not to be scared to ask questions, and to make sure that they actually get the resources round about them that they need. It's often quite daunting for people, particularly if they've maybe moved to a new area or they've lived with a condition and their support network that they've relied on for a long time maybe has changed and they don't really know where to start. So it's about helping them to feel comfortable and confident that they can actually build up a new support network or strengthen the network that they've already got. I think a lot of the benefit is identifying that you're not alone, and isolation can be such a big problem for people. Also just recognising that other people also have the same difficulties that you do or had in the past, and knowing that there is somebody else that you can turn to.
If they self-manage, they learn about their medicines, they learn about how to motivate themselves in the morning when they don't feel like getting up, they learn about peer support. It certainly allows them to lead a good quality of life, and it makes them happier people if they're self-managing themselves and they're not reliant on other healthcare professionals.
I think health professionals have got a role in helping people to effectively self-manage by really walking alongside the people with that condition. And I know we talk about partnership working, but that's, I think, the key. And sometimes it can be complicated to see exactly what is going to help someone to self-manage. So it's really about building that relationship and building that confidence, and really it's about walking alongside someone as opposed to leading and directing.
I think the sessions today are great because it helps people learn good communication skills, and they're able to communicate well between health professionals and also their peers. They know what they need to ask sometimes but can't convey that in the right way, and I think learning all the skills and giving them the confidence and support to do that is really important.
I think for the volunteers it's about giving back. I think we think about it as our own lived experiences, that we know how it is to live with a long-term condition, and for some of us it's just that thing about if you can share one thing to make a difference to somebody's life, then that's really important. So for the volunteers, I think it's about them being able to be in control, to actually have a service delivery that they can be proud of and that they can actually change people's lives.